And now it's time when I invite the special guest of honor, the Honorable Member of Parliament, Rajya Sabha, and former Minister of Health and Family Welfare, Government of India, Dr. Anbumani Ramadoss ji. But before I invite him to address the gathering, I would like to request my technical team to kindly relay a small film made on life and work of Dr. Anbumani Ramadoss ji. Over to you, team.
Dr. Anbumani Ramadoss is currently serving as the Member of Parliament from Rajya Sabha and is the former Minister of Health and Family Welfare in the Government of India. He was elected to the 16th Lok Sabha in 2014, representing the Dharmapuri constituency in Tamil Nadu. He is the leader of the Pattali Makkal Kachi party and is a medical practitioner by profession. He completed his MBBS from the Madras Medical College. During his tenure as the Minister of Health and Family Welfare, he set up institutions like the Public Health Foundation of India, Department of Health Research and Food Safety and Standards Authority of India, among many others, and also established the National Rural Health Mission in 2005 to provide primary health care to the women and children living in the rural parts of India. Dr. Anbumani Ramadoss heads an NGO named Pasumai Thayyagam, which focuses on planting trees, desilting lakes, and building check dams to conserve water. He also proactively advocates for the ban of alcohol and tobacco products. He was awarded with the Luther L. Terry Award by the American Cancer Society in 2006 and is being described as a public health champion by the then General Secretary of United Nations, Ban Ki-moon. We are honored to welcome Dr. Anbumani Ramadoss to the World Health Parliament hosted by MIT World Peace University.
Indeed, sir, the words are true. We are truly delighted and honored to have you here today, sir. Thank you very much for taking time out and joining us. Over to you, sir.
Thank you. I'd like to first thank Dr. Vishwanathan Karad and Shri Rahul Karad and all the Senate for inviting me to share my thoughts on the World Health Parliament organized by the MIT World Peace University. And I'd like to wish my colleagues, the eminent panelists on the panel, and also friends watching this conference through video conferencing. I wish you all a very good afternoon. Happy New Year. Good healthcare is not about building big fancy hospitals. Good healthcare is preventing people from going to these hospitals by giving them good clean drinking water, good nutrition, good hygiene, and a good environment to live in. If the government provides good clean drinking water to its population, good nutrition to the mothers, to the children, to the women, good hygiene, which the government, Prime Minister Modi is already doing Swachh Bharat, and millions of toilets have been constructed throughout the country, and a good environment, 75% of our hospital beds will be empty. Spending for prevention should be more than spending for treatment. We spend 5 times for treatment more than what we spend for prevention. And the government should invest more in health. In India, nearly 2/3 of the healthcare providers are in the private sector, and only 1/3 is in the government sector. My views are it should be other way around. 2/3 government and 1/3 private sector. Take, for example, United Kingdom, where they have the National Health Service, NHS. 92% of the people in UK get themselves treated in the NHS, and where they have fantastic hospitals there, right from investigations to treatment to post-treatment. They even give money for your taxi to go home after treatment. There are other examples worldwide which we could emulate. And yes, the government is doing its best. When you say healthcare, it's both to do with the state as well as the central government. Now, coming to medical education, in fact, today's topic, pioneering disruptive reforms in healthcare ecosystems. Unfortunately, in India, medical education has not taken off in the last 2 to 3 decades. there was this Damocles sword hanging called the Medical Council of India, which constricted the growth of medical education, which restricted the growth of colleges. It was a very unfortunate situation, and the government of India rightly now has brought in the National Medical Commission, which I'd like to commend Prime Minister Modi for. It's a bold decision. We need more doctors, we need more nurses, we need more paramedics, dentists. India has a population of 1.35 billion. And how many doctors we have? The World Health Organization has 1 more million. And how are we going to get them? We have nearly, our nurses population ratio is 1.7 nurses for 1,000 population. We need 3 nurses for 1,000 population. There are 2 million nurses in India. We need 4 million more. And the dentists, we have only 50% what is requirement, more than required. We need 50% more dentists. I'll tell you an example is India. We have lots of issues, lots of diseases, like from communicable to non-communicable. There's been a transformation. And non-communicable diseases like cancers or kidney disease or mental health disorders and all sorts of blood pressures and heart issues and all the issues. And for example, take for mental health disorders. Approximately about 5% of the Indian population are suffering from some sort of mental health disorders. Maybe it's a milder form of stress or depression or a severe form of schizophrenia and other mental health issues. Nearly about 1.5% of the population are suffering from severe mental health disorders. When I say 1.5%, it is nearly about 2 crore people are suffering from severe mental health disorders. How many psychiatrists do we have? Only 9,000 for the entire country. And 98% of them are centered around cities, none in the rural areas. Same thing, we have millions of people affected by kidney diseases. How many nephrologists do we have? Approximately 15,000 for a population of such magnitude. So we need to churn out more specialists. How many of the undergraduates joining post-graduation every year? Only 1/3 of them. Why? Because of the restrictive concept we had for the last 2 to 3 decades by the Medical Council of India. People going out to study from other countries, when they come back, they have a concept called the Foreign Medical Graduate Exam. This exam is tougher than an IAS exam. And I'd like to say that how many of the MBBS students studying here in our country pass the Fmg exam? I'm sure only 20 out of 100 can pass. Such tough. It's very tough. Why? Why do we need to be so restrictive? Shri Rahul had said that, yes, we have so much infrastructure in the colleges. Why can't we use them? Yes, we should use them. Another suggestion, it's my suggestion, like that you could have a morning college and an evening college for medicine. You have these facilities, make use of them. You can have a moratorium for the next 5 years till we produce 2 million medical doctors. Have a moratorium. And you churn out more. We need more quality. We need to infuse into the rural areas. When I was minister, we started the National Rural Health Mission because of the lack of services there in the rural areas, lack of nurses, lack of ANMs, lack of doctors, specialists. And maternal mortality, we can boast of India, but then when we say maternal mortality, it is comparing to Bangladesh. We are worse off than Bangladesh. We are worse off than Sri Lanka. So we need more medical personnel and to cater to our needs of such a vast country like ours. And our hospital beds, we're going through tough times, Corona. Nobody expected such a huge pandemic will affect us. We were very careless in this entire world. And then finally, when we were affected by corona, did we have enough beds? Fortunately, the government of India did good compared to other countries. We have one of the lowest death rates due to corona in the world. And we acted. The government, the Prime Minister acted quickly, unlike United States or unlike Europe, where they took their time and then they paid for it. They're still paying for it. And this corona, yes, we definitely, Dr. Sanjay Oak, I've been hearing him. Nice to hear about words like that. Yes, next 6 months, it'll be going the downside, and vaccines have come out now. And people should get vaccinated. The best vaccine today is mask and social distancing, hand washing. But again, then now we have the vaccine actually with us, and we should all use it and to make herd immunity, whether naturally or unnaturally through the virus, through the vaccines. And my view about corona is that corona is an offset of climate change. I may digress a little bit here. Coronaviruses has been in the offing for the last 100 years. In 2002 and 3, it came as in the form of SARS. It mutated in the form of SARS. Then in 2012, it mutated in the form of MERS. Then in 2019, it mutated in the form of COVID-19. Next what? Why? Because of climate change, global warming. The Earth's average temperature 150 years before was 14 degrees centigrade. Today it is 15.1 degrees centigrade. You may ask, what does 1.1 degree do? 1.1 degrees centigrade is ravaging the world. And if the world leaders don't take action today on climate change and global warming, experts say that by the end of the century, it will increase by 4 degrees and mankind won't exist, people say, within the next 200 years if we don't act today. And ours is the only generation which could act. We can't leave it to the future generations to act, because by the time damage would have been done, it can't be undone. Last year has been the warmest year ever recorded. Last year, we have all been hearing like once in 100-year rainfall, once in 100-year forest fire, once in 100-year severe storm, once in 100-year severe floods, ice-free Arctic during the summer. Lots of words we've been hearing last year. This year, we are going to hear more. Mother Earth has given us a warning through corona, saying that please act. When I say act, it's not like having a target by 2030, India will reduce its fossil fuel consumption, or India will reduce like this. Like today, we have to act. It has to be acted on an emergency basis. We have to declare a state of climate emergency. Not only India, the entire world should declare a state of climate emergency and act on an emergency mode. How we are going to have more problems like corona. I mean, these are the experts which are warning, not me. These are experts which are warning, and we better heed to that. Like coming to research. Unfortunately, research in India has been non-existent. Of last decade, we have had institutions from the public sector having a lot of research, but still we are now nowhere. None of the molecule we have been using in our country for our medicines are founded in India. None. All have been founded elsewhere, and then we have been using them after the concept of patent for 10 years. After that, like we have been using them. We have manufacturing them. For corona, we have been using our first indigenously used founded vaccine, Covaxin, by the Indian Council of Medical Research and Bharat Biotech. But even then, the initial platform is not from them. It's from someone else, but nevertheless, we can proudly call it our indigenous vaccine. And we have institutions for manufacturing these vaccines. Right? So we need more research. When I was the ministry at the time, I visited America. And America, they have a concept called the National Institutes of Health, which is a part of the health ministry and one of the premier research institutes in the world. So when I met my counterpart, the health minister there, they call it Health and Human Services. I asked him, what is his budget for the National Institute of Health that year? He said, Dr. Ramadoss, we have huge budget constraints, and after lots of cuts, we could cobble up only $30 billion that year. I was just gasping because a good thing that he didn't ask me back how much was my budget, because at the time my entire budget for the health ministry was $1.5 billion. That's all. And out of that, how much for research? So it is only about 400 crores. ICMR could cobble up only 400 crores of that. So then I started a department of health research. At the time we had health department, family welfare department, Ayush department, and then a department of health research. I started it. Because when you say ICMR, Indian Council of Medical Research, if they send a proposal to the health ministry for 100 crores, it comes to a section officer. And he said, why 180 crores? Then it goes to deputy secretary. Deputy secretary will cut 10 crores. It goes to the undersecretary. Undersecretary will cut another 10 crores. Then it goes to joint secretary. Then the additional secretary. Then the secretary. And then when it comes to me, it will be 2 crores from 100 crores. So this Department of Health Research was, I made the Indian Council of Medical Research Director General as the secretary level cadre. So from the DG, it used to come directly to the minister to forward it. And then at that time, 100,000 crores of budget was given, but it is nothing for research. We need to invest more on research, and also we need to inculcate research in our undergraduate at the MBBS level to make the student get interested in research when he joins a PG or some other course like. So these are some of the things which we need to do. And finally, I'd like to say about Ayush. It's our own system. It's our own ancient system, which our forefathers have been following. I am a modern system, I'm an MBBS doctor, but I love Ayush. I come from Tamil Nadu, where we have Siddha. Ayurveda is followed throughout the country. Naturopathy, yoga. Unani has come from Persia. Homeopathy has come from Germany. Yoga, founded in India, exported to America and imported to India. Because we have been following these Americans. Why yoga has been followed today is because it has been scientifically validated. Because we are not scientifically validating our resources. These resources are centuries old, millennials old. But we have not been researching on them. What are the Indian systems, the Siddha, which in Tamil Nadu, is our culture, our values, our heritage, our festivals. Some of the festivals we have, like a kite flying festival, is children go out in the sun and fly kites, where they get vitamin D from the sun. Today, none of them go out. They're all in the computers and phones and all sorts of things. So these are some of the things which are imbibed in us, imbibed in our culture, imbibed in our values. So we need more investment in our own systems, and we need to follow and ask youngsters to do it. And we need a lot more research into that. We had turmeric, neem, being patented by America, by UK. At the time, we had to spend 5 crores to de-patent it. And then we started a concept called a Traditional Knowledge Digital Library, TKDL. So we got all the inputs from all sources, various sources of Ayurveda, Siddha, Unani, homeopathy. We compiled it, made it digital, and then we patented it. We listed it in all the patent offices all throughout the world, so no one could patent our rights. So these are some of the things which we did. And finally, I'd like to say that during the Corona times, testing times, we were sitting at home. We could only do yoga. We couldn't even go out for a walk. So yoga is something where it needs to be inculcated at the school level. It should be made compulsory at all the schools in the world, like in our country, that yoga should be taught at the primary level. And that's where, because we need our future generation to be healthy and in the mind, body, and soul, so that, and this yoga, I'm sure, could go a long way and doing this. And I could go on and on, but I'm sure there are a lot of other eminent personalities who would like to share their views and thoughts as well. And with these words, I'd like to again thank the Karad family and all the Senate and all the members who had invited me to share my thoughts. Thank you very much.
Thank you very much, Dr. Anbumani Ramadoss ji. Indeed, it was a delight to listen to your views. And I mean, as a teacher, I could figure out, and everyone in the audience must have figured out, the study, that the depth of information and its use, the way you were sharing with us. Amazing, sir. Thank you very much. I'm sure our Honorable Vice Chancellor, sir, would like to share his thoughts after listening to your views. Sir, if you would like to say something.
Dr. Ramadoss, vanakkam.
Vanakkam.
Thanks very much for today's address. But I took this opportunity to particularly thank you, sir. About 15 years ago, when you said India bans smoking in public, how is it possible? You said no cigarettes in railway stations, no cigarettes anywhere. And you even went on to say, sir, no hero would on screen, nobody would be smoking. I said, no, this just cannot happen. How can we see Rajinikanth on screen without a cigarette or say Shah Rukh Khan? Sir, you had the guts. You had the guts to fight the cigarette lobby, tobacco lobby, and you had everyone, sir. So that shows your commitment. I wanted to take this opportunity to tell the whole world watching this. So here is a man who can take any lobby, but he wanted so committed for the public health. Sir, I salute you, sir. Thank you very much, sir. Thanks for coming on. Sir.
Thank you. Thank you.
Thank you, Dr. Ramadoss, sir. I will just take a half a minute that long back you visited my institution. I'm taking little opportunity that here the medical education disruption, and it's such a pending issue. So I will request, sir, that in Delhi sometime this follow-up persuasion is needed. I think I was told that there is quite a working going on at central level, but it is a high time, sir, for medical education. I feel really shameful over 2 medical colleges we run here, sir, and the kind of perception society carries for medical education in this country. It is so bad, so, and I think we need to change all this.
Absolutely, Rahulji. Medical education shouldn't be in any clutches. It should be free, and we should progress. We should move forward. We have so much infrastructure. Make use of it. And we are doing service. I mean, whether it's the private sector or the government sector, and we need to produce more quality. Like say Cuba, it's a small country, but it is supplying the world of medical personnel. We need them ourselves. We need them ourselves. And also government starting out aims like institutions, which I commend the government to do, because they are going to produce more quality healthcare personnel as well. But that is not enough. So we need entire resources, and definitely I will do my role at the center during the parliament and off the parliament. Definitely, in whatever way I'll make myself useful to augment the medical education of this country.
All the medical fraternity, I request, sir, that your support is needed, and you all must come together, all party people, and think about this is a long pending issue, and it's a very, very painful.
Absolutely. Thank you.
True. Indeed, true, sir. Thank you very much, Rahul Karat, sir. Thank you very much, Dr. Anbumani Ramadoss ji, for sharing your thoughts.